My name is Jennifer Bacani McKenney, and I'm a family physician in my hometown of Fredonia, a town of about 2,500 people in southeast Kansas. I'm extremely grateful and incredibly excited to be the NRHA's 2021 Rural Health Practitioner of the Year. The last year has been a huge challenge for our entire country, and I know for me has been one of the most challenging experiences in my life, both personally and professionally. This award is especially meaningful because of all the ups and downs of the last year. The heartaches and the victories, the lives lost and the lives saved, and the many lessons learned. I've been serving my rural community for the last 11 years from the very hospital where I was born and where I now work alongside my father, who has been a rural general surgeon and primary care provider for the last 42 years. Like many rural family physicians, I wear multiple hats every day. I serve on our local school board and was the president for 2 years. I've worked with teams of like-minded community leaders to launch a nonprofit community foundation, a community growth initiative, an immersion medical academy for local high school students, and an annual fundraising festival. I also serve as my county's local public health officer. While caring for patients through the pandemic, I have continued to practice full-spectrum family medicine at the Bacani McKenney Clinic, a clinic I own and manage. I care for patients with chronic, acute, and preventive health needs and see patients from birth until death. And this year, I helped swab noses for COVID-19, offered parking lot visits to keep patients safe, used telemedicine to comfort and counsel my patients who were scared or feeling isolated, and donned and doffed PPE over and over in the clinic, hospital, and emergency room. Through all of this, I shared information through countywide weekly COVID updates to community leaders and through Facebook Live sessions to the broader community with our health department administrator. I discussed masks, vaccines, social distancing, health orders, and the difficult decisions public health faces in the pandemic. I've tried to rely on science and social media to educate others and battle misinformation. These are my people and my community. This is my home, and the people of my community are worth all these efforts. This last year has also revealed how far we have to go to achieve health equity in rural communities. Rural populations face so many challenges, and within them, there is unrecognized diversity and many subgroups that are marginalized and need more attention. We are rural folks. We are resilient. We meet challenges head-on. We care for each other, and we forge ahead. We find solutions, and we find a way. None of us are on this adventure alone. I could not have achieved these successes without my wonderful family and friends, practice partners and staff, and so many supportive people in my life. Thank you to all those who have loved and strengthened me, and thank you to the National Rural Health Association for recognizing our efforts.